All right, thanks for your patience while we got set up here. We've had some really cool talks today about some of the research that's been done with the Shield Illinois data. This panel's a little different. This is going to talk about kind of the logistics of working with Shield Illinois data, and we have a whole group of people who work with the data to talk about their experience working with it. So we're going to start off with introductions. Everybody's going to introduce themselves and talk about what type of data they're working with from Shield Illinois.
So my name is Alicia Kraay, and I'm an assistant professor at University of Illinois at Urbana-Champaign. And I've been working with data on testing sites when they were open and closed by county across the state of Illinois. And I've been pairing that with surveillance data to try to estimate the overall impact of testing on incidents and deaths.
Hi everyone, my name is Huang. I'm a postdoc from Professor Becky Smith's lab. I'm working with the Shield Illinois data, testing data from K-12 schools. So we have how many student or employee are testing and how many of them are positive or negative, and at a school level. And the data are daily.
Hi, my name is Margaret. I'm assistant professor from the journalism department from University of Illinois Urbana-Champaign. Together with my colleague Harsh Taneja and Eva Maslowska from advertising, we are actually examining how effective Shield Illinois public communication have been on the social media. So we have been asking Shield providers data with their social media presence, with their YouTube, with their Twitter, with their LinkedIn, with their Facebook, with their Instagram. So we get a lot of data from them on their, because they are the account holder, so we get to see their analytic dashboard with the data, how effective their message really is reaching out to the people in Illinois, even the world. We also look at the news coverage, how the news organization from all over the world actually look at Shield effort, how they frame it, is that effective or they're feeling doubtful. So we also get news data from Shield, but we are also adding more data by ourselves, which we will talk about it more later.
Good afternoon, everyone. My name is Anton Ivanov. I'm an assistant professor at the Gibbs College of Business, and I'm also part of the HEART group, and the members of this group, my colleagues, have been presenting our work quite comprehensively moments ago. So we've been with Shield Illinois for quite a long time and have had exposure to a number of different data sets provided by them. Most closely and most recently, we've been working with two particular data sets. One is for the K-12 schools data, and that has been part of our work on the adoption of the different consent models for the schools. And another one is related to the aggregated university level data that was published as part of the dashboard provided by Shield Illinois to the local community. And that's, that data represents part of the work that I will be presenting tomorrow on the role of the social media in addressing the implications associated with the pandemic.
Hello, everyone. I'm Rhiannon Clifton, Senior Director of Integration for Shield. So you've heard a lot of different kinds of data and data analysis that folks are working on. Shield we've done, I think, 7.5 million tests now, so we have all of that de-identified testing data. We also, have that over time. We heard from the professors that were, looking at testing adoption over time. The school's testing models, last year versus this year. We've got race and ethnicity data. It's, we have geographical, like any kind of thing you can probably think of, we likely have in some way, either through our systems or in some cases we've been able to go back and interview schools and connect researchers with, the actual testing partners to be able to investigate, what they did and how that worked and things like that. So we have quantitative, we can help with qualitative, and when you apply for one of our grants, we can help get that data for you, depending on how you want it, and help build that out.
All right, so that's a little bit about what data are there. But within Shield, Illinois, it's not all the data that you're ever going to use. So maybe we could talk a little bit about other data sources that you've used and how you integrate those with Shield, Illinois data. Especially, we think a lot about spatial and temporal scales and how you can get those to mix together really nicely. So I don't know who wants to lead off on that.
I'll take this one, gladly. So, one really has to understand that whenever you have to work with health-related outcomes, it's quite difficult to account for everything that could possibly confound your estimates. Now, to this end, one really needs to have a very significant set of control variables. Now, in our work, and again, in some of the work that I will be presenting tomorrow, we've used nearly 30 different variables collected from a variety of different public and proprietary sources. Now, broadly speaking, I can categorize those data into, for example, university testing policies, mobility data. And when I'm saying mobility data, you can think of it as internal and external mobility. It's the population characteristics, such as the population, number of people in a given region, density of population. You can also think of the safety measurements, such as prevalence of mask wearing, social distancing indices, some other things. You can also think about it from a perspective of political affiliation, which is also one of the notable confounders that one should definitely keep in mind. In addition to that, am I overlooking anything? Depending on the level of the analysis, if it's a school level, for instance, one would need to obtain school level characteristics for the given entities. Similarly, if it's a university level analysis, one would have to go and find some relevant information pertaining to the universities in particular. That's just a small bit of it, and then I would assume there will be some other questions relating to challenges associated with merging this data, and I will comment on that separately.
So my research group tried to cast a really wide net to look at Shield in different platforms. Shield have provided us, for example, with their Twitter data in they provide us in a PDF format, which is not very user-friendly when we do the first step to do the cleaning, but at the same time, we can look at some data that from outsider, if we are not an account holder, we could not see that kind of rich data. Those data they provide have like a number of likes for each tweet or sharing of each tweet. But when we, as a researcher, we try to look at how the diffusion backward of if Shield trying to tweet one post, how people try to retweet it. And at the same time, we want to see how people talking about it. So those kind of data, normally you need to use the Twitter API, which I think is dead for now. But at that time when we collect the data, it's still there. So we try to get all the reply or people who mention Shield on Twitter to see how people like it or how they frame it, the whole sentiment and phonetical analysis that provided with that. So we have to add on with a lot of using Twitter API or Facebook API to collect more, enriching the whole data set to see how people from the outside talk about Shield. And because we are trying to cast a wider net, we also look at a lot of to see if Reddit, any people talk about Shield, is that Google trend, Google News or Google search trend, is that those kind of pattern, if that align with the number of tasks Shield have been doing each day. So we just add on a bunch more metadata from social media to enrich our analysis.
Yeah, I think the data that I've used has been fairly similar to what Anton has used as well. So I've been doing analysis at the county level, and so I've been using census data on population size and population characteristics to inform the models. And then it's important to think about, whether a test is positive or negative when you're looking at the impact of a specific site. But we were also interested in looking at indirect impacts on transmission at the entire county level. And so we paired that data with publicly available surveillance data. In our case, we use COVID Act Now, but we've also looked at some other sources as well. And then we're right now working on integrating information on policies that changed during the COVID pandemic, so things like mask mandates, which you can, it's again, very similar to I think what Anton's talking about, but just a little bit different in focus.
The data, other database that we use outside of Shield, Illinois are very similar to Professor Anton and Alicia's mentioned. We also look at how the county level incidence rates from CDC over time, and also the vaccinations progress in all the county level that the schools located in, and also the sero prevalence, which is determined by the antigen test to estimate how the proportion of the people that got recovered before the semester started.
And I'll just add, this is only a sample of the data sets that are available and useful. So other research programs that I have going on, we've looked at things like there are county and state level policy timelines of when different policies, when were daycare shut, when were schools shut, when were mask mandates in place. If you're working on university data, the College COVID Initiative at Davidson College has information on all the university and college COVID policies. They were scraping it on a daily basis from all the university websites. Their only requirement is that you involve one of their undergrads in your research, which is a joy to have undergrads joining your research. Seriously, it's wonderful. And there are other data sources. Some are easier to get to than others. So speaking of easy or hard, what challenges have people had with the Shield Illinois data or with integrating it with other data? As we know, epidemiology is 80% data cleaning.
Perhaps even 90. If you would like, I can start. Well, obviously, whenever you work with data, and those of you who have been doing that know how challenging it might be sometimes. Now, I have to admit that Shield data was absolutely great. I mean, not without some caveats, but it was absolutely great, and especially it was great from a perspective of the quality of the code books provided to you. And that really facilitated a lot of, addressing a lot of challenges on our end. However, one have to admit that you need to deal with some unstructured variables. You need to take care of some categorical measurements. You do also need to address some of the not missing values, but I would say zero values for certain time periods when there were no tests conducted, for instance, or when the positivity rate was consistently zero over a period of time. So those were some of the minor things that a person would need to address. Now, the three most important challenges that I would emphasize are the following ones. First one needs to be clear as to what kind of merging variable they're using. Because if your merging variable is the name of the school, for instance, it's still not as straightforward because other databases might have a difference in a single letter for that given observation, which will spit out an error and saying that something's wrong there. So merging is one consideration. Another consideration is the temporal dimension. Now, in most instances, Shield data is based on the daily granularity, so to speak. However, other data sources, for example, one of the data sources I did not mention was weather. Now, weather is generally, at least for the public, provided at the weekly level, for instance, for a given geographical location. How do I address that? So one needs to take that into account. To make things worse, sometimes other data sources might be providing data at the monthly level. Well, how do you adjust for that? Because the moment you aggregate everything to the monthly level, well, you're missing a ton of observations and potentially some useful information. And finally, I would also like to point out that when it comes down to modeling the pandemic, studying the effects on the health outcomes, one needs to take into account the spatial dimension. And with that, I mean, if we're talking about counties, counties have some geographic locations in terms of the latitude, longitude, centroids. If you're talking about cities, again, you might need to figure out what the geographical location of that is, so that not only you are more flexible with merging your data with other data sets, but you're also taking into account those spatial heterogeneities that are likely to influence your outcomes. So these are my couple cents.
So for my research group, I would say that when we first communicate with SHIELD, when we ask for different platform analytic data, they're really welcoming, and then they just try out, like, do have server core, email exchange, and try to follow what we ask for. But that's why when talking about challenges, it's definitely not their fault, because as a researchers, or as the thinking for researchers and people who run the social media are actually pretty different. And we are actually looking to examine the effectiveness of their communication after they have done 2 years already. So sometimes how you set up a social media account from 2 years ago already, if missing that point, we already lost part of the data. For example, we are asking for YouTube data. We envision we could get the YouTube comments underneath the YouTube video of SHIELD. But unfortunately, their YouTube account actually disabled the commenting section. That's why we could not analyze how people are talking about the video about that. And the second thing that I think is great, that when we ask for news coverage, that maybe they already collect a lot of hyperlink, that their news organization, how they talk about SHIELD, they pass us a bunch of hyperlink on those news articles. But as a researcher standpoint, just having a hyperlink, click on it to look at it, actually is not you can do the analysis right away, right? So we try to also make sure that we have comprehensive lists. That's why we also use Google News API and also different database, news bank to try to see, triangulate if the data source is accurate, exhaustive enough. But at the same time, we also need to have some very neuron metadata within it. Like, is that the news organization name, their time to publish, and what kind of news organization they are. We have to do our classification. Is that a local news? Is that international news? Is that TV? Is that just a press release by the University of Illinois, which is not technical news? So just a hyperlink is the starting point that they provide us, but we also need to try to make sure the data they provide us is comprehensive enough, is large enough, and then we also need to do a lot of scraping, and then build our columns, if you're thinking it as a more spreadsheet format, to build all the columns so that we can have some meaningful analysis within it. But anyway, I was just saying, SHIELD is the starting point when you negotiate about the data, but after that, you also need to do more data collection, do more cleaning to do the analysis that you wish to do.
Just as previous mentioned, that we started with the school level data, SHIELD testing data, and then we got the school characteristic from the National Center of Education Statistics for how many students are attending the school and how many the employees in them, and there's a merging process to matching the school names and abbreviations in between my database. That's actually a challenging part in the beginning. And also we also need to try to incorporate the mass hearings in schools. But the only data source we have is from the Facebook surveys, so which only collect adult answers, opinions in the public aggregated database, and only 30% of the US population answered that Facebook survey. And also it's a state level, so it's not spatial oriented enough for a school level too. So, so we need to make a lot of assumption in the process too.
I'll just point out, adding on to the, the researcher and the, the operations viewpoints are different, right? So there may be some data that we don't have. Like we didn't have a CRM until last summer, maybe, right? So like there may be some holes, but we will do our best to try to help you fill those in with all of our spreadsheets.
And I will add, one of the joys of working with Shield Illinois data, if you've worked with public data sets, they have a data dictionary that they stick with, and so you know that all of the data follow their data dictionary. Some of these public data sets, for instance, it was once identified that there were 5 different definitions of test date in the CDC database. So it might be the date of the tests collection, it might be the date that the sample arrived at the lab, it might be the date that the lab resulted, it might be the date that public health finished their investigation. I don't even know what the 5th one was. But within the Shield Illinois data set, you know that date is date. You know that address is address. So those things are fairly consistent, but when you're trying to merge with outside data sets, know that there are different definitions that you might have to match up. And that can be challenging.
Yeah, one of the things that we were trying to do is figure out when sites were open and closed, and data weren't stored exactly that way for the same reasons that she's talking about. But what we were planning to do, and we still don't have access to, is get the actual dates that all the tests were conducted. We've had issues with our IRB, which has delayed us a lot. And so we kind of had to be creative in the way that we summarize the data and kind of aggregate up to a higher level of resolution than what we ideally wanted to do to account for the way that the data was stored and the type of data we were able to get.
So we have a few minutes left. Are there any questions that people out here have for people who have worked with the Shield Illinois data?
Just a quick one. It's not specifically a question, but in terms of the data challenges, one that comes to my mind is the lack of a denominator. So pretty much, in most cases, what we have is number of tests and number of positive tests. So in most cases, what we have is number of tests, number of positive tests, and then some, let's say, group level variables, county level or things. So it appears to me that the next step, and you guys are planning to do new studies, it would be important to have some population data in which we could have denominators for, for example, what's the proportion of the population that took at least one Shield test? This type of things, I think, could be done and would benefit. If we think Shield as an intervention, which I think it's what we should do, having like population-based denominator data would benefit you a lot.
So the number of unique individuals included in a particular test site, for instance.
And we can get to that for you.
Any other questions?
The challenge of the merging of data come up a couple of times, and specifically the naming of the nomenclature of the schools. I think I heard that. Did you ever use just give each school a unique number so that it was easy to cross-reference it? Because I didn't know this until we were doing another project, but I guess every school does actually have its own. Every public school has its own unique number, so that you get away from that naming challenge. So that was one thing, but just a comment as well. It's just great to hear all of the activity around data that was going on in the background. I really appreciate you because we would look at the findings from your various analyses on a weekly basis, and it was really helpful from a public health decision-making standpoint. So really appreciate that. And lastly, I'd love to know if the person that was responsible for when we first rolled out Shield to K through 12, there was a pretty broad multivariable analysis that was done so that we could get at the equity, to make sure that there was a lens on equity where we thought about variables such as socioeconomic status, the social vulnerability index, school lunches, a number of variables that we were considering, and someone did a pretty sophisticated analysis around that really was helpful. I know Ron would know who, but thank you to that person.
Well, and I know we also, as we were deciding, right, with you, the funding and who it was opened up to, we incorporated a lot of that existing data into our CRM, and so that we could measure things like percent of the population that's being tested, those unique individuals, things like that. So we also use some of those secondary databases to help in getting testing sites up and running.
All right, it looks like that's our time. One more question? Sure.
Last one.
Yeah, I was just wondering if you considered or had an opportunity to look at access to care, kind of similar to what you're asking about, but in rural communities where a provider, an access point may be 50 to 100 miles away. Did that come into the calculation at all as far as outcome measures?
So I don't know if this is exactly what you're asking, but we did look at if there was a difference in the proportional impact of testing in rural counties versus urban counties, which would get a little bit at your access question. And we found that urban counties had higher incidence, which makes sense. They have a larger population, more dense, and rural communities had lower. But the proportional so people thought that maybe in these rural counties utilization would be lower, and so the impact of testing might be lower also. We did not find that. We found that the proportional impact was essentially the same. So kind of relating a little bit to this access question, maybe not exactly what you're looking for, but that's something that we've been considering in our work.
And this isn't necessarily data that we would have, like that we created, but we did use all the schools who were interested in testing to create, Ron presented our list, or our labs and funnel sites in Depot, and we really looked at that to make sure that no one would have to go more than an hour to drop off samples from a school, for instance. So we developed a transportation network to help that piece of the equity puzzle.
And I can share from our pilot work with the K-12 schools. Our pilot K-12 schools were all serving underrepresented minorities and low-income communities. And several of them came to us and said, this is great, can we open it up to the community? Because they knew there was no testing in their community. So a lot of our pilot schools also became community testing sites because of that lack of access. So it was a great way to scale up there. We have one more question.
No, Anna's saying no.
We have been told no, so we are trying to get back to schedule.
Yeah,
but we're all around, so
yeah.
you can ask us questions afterwards during the reception with maybe a glass of wine in your hand.
Absolutely. Wine and data. All right.
Thank you, everyone.